So Chloe, you can introduce yourself and tell us a bit about your professional background.
Okay, so I've been a therapist for about 6 years now, and previously I was working in a public hospital for about 3 years, and then I moved to the private setting. So I'm currently with Balance Core Physiotherapy Center for close to about 3 years as well, and we mainly see patients with chronic pain. I myself, I do a bit of pre and postnatal rehab as well as individuals with sports injuries. Yeah.
Okay, great. As you know, we have quite a number of players, and especially the regular players. After because some of the common complaints would be like discomfort on their elbow. I guess we call it a tennis elbow.
Tennis elbow.
Yeah.
Yeah, that's right.
So perhaps it'd be useful if we can find out more about it in this conversation.
Yeah, sure. So I actually went to Google to find a picture so that it can be easily seen through the picture. So basically, tennis elbow is a sort of a tendonitis. So tendonitis means inflammation or swelling of the tendon. And this tendon, we are looking at the common extender tendon over here, which are connected to, of course, the extensor muscles of the wrists and the fingers. So basically, these muscles help to perform actions that involve like wrist extension or fingers extension. Tennis elbow basically will give pain right at this outer part of the elbow here, and sometimes the pain may even be referred like to the lower part or the of the arm or the upper part of the arm. I think for tennis elbow wise, even though you've seen it a lot in your players, right? During my clinical experience, actually a lot of my patients who have tennis elbow do not necessarily play tennis. In fact, yeah, I think it's because basically overuse of the muscles that requires a lot of repetitive movement that have an individual doing movements that involve a lot of gripping or movements like that that can actually cause someone to also have tennis elbow. That's right. Yeah. So if let's say you do have pain over the area at the outside of the elbow, it's best to just see if whether you are having any swelling around the area as well. If you do have swelling, actually it's best to perform icing around the area to help to manage the pain and swelling. Sometimes icing about 10 to 15 minutes every 2 to 3 hourly will actually help the pain to be managed better.
Okay. Just from the image here, the injury is on the tendon. Am I correct?
Yes, that's right. It's actually micro tears on the tendon. Yeah, and then there's inflammation and pain due to this repetitive movement of like the wrist and the fingers as well as gripping actions. So most of the time, these injuries can be acute. You know, sometimes it just happened to someone in like about a few days, but sometimes it can be chronic. Some people may be experiencing it for many, many years or many, many months. And when it becomes a chronic issue, sometimes the tendon actually weakens. So it's not as strong as before. And that actually can lead to a bit more complicated management because it actually takes a lot more time to actually try to heal as well as improve the strength of the tendon.
Yeah. Okay.
Yeah.
Sure. Yep. Okay, great. Yeah, and I actually have a few more slides for us as well.
Yeah, that's right. So actually for physiotherapy, if let's say you are not seeing a physio, you can try to do icing, like I mentioned before. Otherwise, usually in the clinic, some physiotherapists may recommend doing ultrasound treatment. Ultrasound treatment basically, it can help to reduce swelling as well as manage pain around the area, which has to improve healing of the tendon. So your therapist should have the knowledge to adjust the parameters accordingly to actually improve the aspect of swelling and pain. Yeah, that can be helpful also as well to manage tennis elbow injuries. Alternatively, sometimes your therapist will also perform some sort of like a trigger point release on the muscular belly. So you can see from the picture, basically trigger points are found along the muscle belly, and trigger points are known as focal muscular tension, and they can be palpable under the skin. Sometimes if your muscles are quite tight, you can feel there's like some knot or some sort of bump. You can feel it along the muscular belly, and these are actually known as trigger points. So your therapist might actually also perform some sort of trigger point release to help to release these muscles.
Okay,
Yeah.
trigger points release mean they would press the muscle.
Yeah, press the muscle. Yes, correct.
Mm.
So by actually providing a constant pressure to the muscle, muscles actually can trigger a sort of like a release so that it doesn't remain so tense as what it used to be before.
Okay. Would this involve any needles as well?
You're looking at my next slide, right?
Oh, okay, that's the
Yeah.
next slide. Okay, we will stop.
Yeah, that's right.
Sorry,
That's right.
you can go back to slide 3. Yeah, you mentioned ultrasound. Yeah, this is it how does the ultrasound work? Is it through heat or through
Yeah,
some
some
ways that
ultrasound machines, yeah, they can produce heat.
yeah.
Yeah. But usually if let's say the swelling is quite visible, I don't think your therapist will adjust the parameters to allow the ultrasound to produce heat, because with heat that might actually increase the swelling and it might actually worsen the situation. So for chronic swelling or swelling that has been around for a long time, maybe then the ultrasound can be adjusted to produce a bit of heat to help a bit with the swelling dissipation. Yeah, basically ultrasound uses ultrasonic waves to penetrate deeper under the skin. There will be a medium like a gel used to apply on the skin surface. So the ultrasonic waves can actually penetrate through the gel underneath the skin to actually target deeper structures of the human body.
Okay, great. Yep.
Mm.
Okay, so now we move on to the needles, is it, on slide 5?
Yes, that's right. Yeah. So apart from trigger point release, actually, some therapists might be also be trained to perform some sort of dry needling. So dry needling is just a technique whereby a needle or thin filament is actually inserted into the muscular belly. It is not similar to acupuncture. Acupuncture is something that I think most of us are familiar with, right? So acupuncture, basically the rationale is a little bit different from dry needling. Acupuncture is meant to kind of improve, also release muscular tension, but maybe more overall muscular tension, as well as improve like the qi, Chinese we call it the qi, or like blood circulation in the human body. But for dry needling specifically, it's meant to be placed, the needles are meant to be placed in a specific muscular trigger point. The aim is actually to help in reducing muscular tension. So the therapist will have to identify these trigger points to strategically place these needles along, this tense muscle. And of course, when the needles is placed, the muscle will some muscles will produce some sort of a twitch response. And it's like an involuntary contraction of the muscle to actually help the muscle to relax, and then thereby improving like some sort of muscular regeneration. So this can be very helpful for chronic pains, muscular pains, tennis elbow pain that has been there, deep set tension. Yeah. If let's say trigger point release doesn't work too well.
Yep. Okay, great.
Yeah. Okay, so coming down to like the last few portions. So if let's say you do find that you have a lot of tension along the upper part of the forearm, of course you can perform stretches like that as shown in the picture to help to increase the flexibility of the muscles. But I'm not like a very strong advocate for stretching, because I feel that stretching is usually more useful if let's say the condition is not so chronic. When some muscles have been tense for a long time, then other methods such as trigger point release or dry needling actually is more helpful. Stretching may just give you a sense of general relaxation, but it's not really targeted or specific in a way. So if you are just doing stretching for your tennis elbow injuries, it could be just touching the tip of the iceberg. You might need to explore other methods to actually allow the muscles to be completely relaxed so that you may experience a more long-term pain relief in that manner. Yeah.
Yeah. So this does it mean that if the player has already a tennis elbow, then if it does stretches, right, it will not really help in his recovery.
Yeah. It
Yeah.
would just probably help to manage his symptoms for a while, but he or she will definitely find that this pain will keep recurring on and off. Yeah. And like it doesn't really provide long-term pain relief in a way.
Yeah.
Yeah.
Okay.
Okay. So coming to the the last portion as well, right? We talked about how to actually prevent such injuries. So I think,
sorry, miss slide 7. This is
oh yes, yes, yes,
yeah.
yeah. So slide 7 is basically strengthening of the muscles. Just now I mentioned before that sometimes when you have a chronic injury of the tendon actually weakens. Yeah, so your therapist will actually prescribe you some sort of exercises at a appropriate stage to help to strengthen these muscles. And these exercises could involve some sort of eccentric strengthening, whereby you are actually contracting and actually lengthening the muscles as well. So these exercises can be helpful for patients who have more chronic tennis elbow injuries. So in a nutshell, the management of tennis elbow involves from depending on either the acute stage or the chronic stage. If it's acute, then of course icing will help to manage the pain, and thereby if let's say the pain is still very persistently there, dry needling, muscular trigger point release is helpful to further reduce the symptoms of the tennis elbow. And last but not least, your therapist will prescribe some sort of strengthening exercises to help to strengthen the muscles so that this will not occur again in the future.
Okay. Yeah, can I just clarify what is the acute and the chronic?
Oh, okay. Acute injuries are basically injuries that that last for for the first 1 to 3 days. For example, if you sprain your ankle while walking on a pavement and then you straight away see that there is like a visible swelling and you straight away can feel pain on your ankle, the first 1 to 3 days are actually known as the acute stage of this injury. So once this injury has or this swelling has subsided over time, the next stage is actually, we call it subacute, whereby there's still pain, but it's not so swollen. And
Okay.
this stage is usually from the 4th day onwards to
Yeah.
the next 1 to 2 weeks, yeah,
Okay.
whereby maybe the management would be just to continue to manage the swelling a little bit better and try to improve the range of your joints and then help to improve the muscular flexibility. Chronic injuries are usually much longer. Sometimes
Yeah.
it's months or years that we are talking about. And these injuries are like, you won't see that the swelling is as visible as what you have in the acute stage, but sometimes there might be, small bouts of relapses or like small visible swelling on and off, like
I see.
comes and go, and it doesn't go away completely, because
Yeah.
actually the body has the ability to heal.
Yep.
But when it comes to a period of time whereby the body just cannot heal completely, it
Okay.
just keeps coming back and forth, back and forth. That's when it becomes like a chronic issue.
Okay.
Yeah, so there could be some underlying things that needs to be changed in terms of either the way that you do things or your activities of daily living, some sort of postural problems or other issues that actually can lead to always having this chronic pain occurring again and again.
Okay. Yep.
Yeah. Okay, so since we are at the topic of chronic pain, then we can talk a little bit about like the underlying root causes. So I think most of the time for tennis elbow, it's important to look at equipment, right?
Yeah.
So Darren, this is your area of expertise. Yeah.
Yeah.
Some of my patients who have tennis elbow and they play tennis, right?
Yep.
I found out that sometimes it's also due to the grip size of their tennis racket. If let's
Okay.
say the grip is not good for the size of their palm, either it being too small or too big, that will affect them, either having to grip it too hard,
Yeah.
or when they try to, upon contact with the ball, actually the wrist has to work a lot harder. So that could actually lead to tennis elbow, or
Yeah.
even the weight of the racket as well. If it's too heavy for someone to handle, then it might lead to this kind of injuries. You're at a higher risk of getting this kind of injuries.
Yeah.
So
Yeah.
important to get,
Mm.
a coach to
Oh,
access.
yeah, I think you're right. Yeah, if the grip is too large for the player, they might be using excessive strength to just to have to maintain a good grip on the racket. Yeah, I get,
Mm,
and I guess this can cause more tension to their forearm. Yeah.
yeah, that's right. Do you routinely, check the grips of your players, like whether it fits them?
Yeah, so usually when we recommend the players to get their own rackets, we will recommend especially for so depending on their height and their size, usually we recommend a smaller grip size. Yeah, yeah, because
Oh.
because once they have a smaller grip size, they can always use an over grip to
Oh
create
yeah, that's right.
larger grip. Yeah, so it's easier to make the grip larger,
Rather
instead of,
than make it smaller.
making it smaller.
Yeah.
Yeah,
Makes sense, makes sense. Yeah.
yeah.
True.
And I think for yourself, your grip size, yeah, should be fine. I think I saw your racket. If you are still using the racket.
Yes, that's right. It's
Yeah,
perfect. I like it. Yeah. So
yeah,
I think yeah, grip size and weight of racket is very important.
yeah.
Yeah. So
And yep,
depending on the gender as well, right?
yeah. Then concerning the weight of the racket, for female players, we usually recommend a weight that's below 300 grams. Yeah.
Oh, okay, sure.
And then for guys, yeah, they can take above 300 grams, 300 to probably 320 grams. Yeah, but in general, for female players, less than 300 grams. Yeah,
Below 300.
yeah,
Okay, cool. Yeah. So I think that comes like the big portion of like the underlying root problem as to why someone is gripping so hard. I think a lot of it also boils down to technique, right? I was taking tennis lessons for a while, and then I think also the coach was telling me, don't grip your racket throughout all the time. You have to only grip it when you're upon contact with the ball. So if let's say like a beginner who doesn't know that they don't have to grip it all the time, sometimes someone might be quite nervous, playing tennis for the first time, so they might be gripping excessively throughout the whole game. Then of course this will cause overuse of the muscles. So I think a lot of like involves a lot of technique as well, how to grip, when to grip as well.
okay, okay, yep,
Yeah. I think lastly is also the way that, we hit the ball. I think most of the times when the ball comes to us, we will focus a lot on just using our arm or wrist strength. So rotation of the trunk and the torso will actually help to transfer the force over to the upper limb, and that actually can also help to reduce a lot of strain on the arm and the shoulders as well. So I think the key thing is, correct me if I'm wrong,
yeah.
to
Mm.
allow your arm to be quite free, and then your trunk will lead the way so that your arm will provide the movement.
Oh yeah, yeah, definitely correct. I think you have been coached well. Yeah, you are aware of the theories, yeah, and the technique. Yeah,
Okay,
yeah, because
that's
we
good.
don't want to put too much strain on just the forearm. Yeah, so instead of using just the forearm muscle, we make use of the larger muscle groups.
Yes, that's right. That's right. Yeah.
Yeah,
Because as you can see from the picture, yeah, we have a lot of larger muscle groups, the trunk, even our legs can help to provide this energy
yeah,
to transfer to our arms. So I think that would be something for someone to look at if let's say they're suffering from very chronic tennis elbow, maybe possibly like a coach to look at their techniques or even their equipment. It might help to reduce the occurrence of such injuries from
okay,
happening again and again.
okay.
Yeah.
Yeah, yeah, great. And yeah, and for players who have tennis elbow, would you recommend them to just rest, or would you think it's better if they were to visit a clinic to undergo one of the treatments? Is it enough that they rest at home, or should they actually try to undergo some of the treatments outlined here?
Yeah, I feel that if you are having a tennis elbow for the first time, then it could be ideal to just ice, rest, and then wait for at least about 2 weeks before you return to your activities like playing tennis. If you are returning to playing tennis, then of course you need to start with a little bit more of warm-ups. Shouldn't just start playing at a very high intensity. Maybe start a gradual warm-up and see how you actually how your body perform during that game. And if let's say the pain is still happening and you're still having swelling, then it's best to actually seek either like a doctor or a physiotherapist who will help to manage the pain better. Some doctors might prescribe medications such as non-steroidal anti-inflammation or NSAIDs for short to help to manage the pain, and that might actually help the body to start to kickstart the healing process already, because as long as there's swelling, healing cannot occur. So if let's say the doctor prescribed you some medications, and by taking the medications the pain actually reduced quite well, and with a proper period of rest, returning to activity doesn't give you much symptoms, then I would say that it's okay to, you know, manage your symptoms through regular stretches or even just massage over the area. But if these symptoms keep recurring, even despite you having medications, rest, icing, self massage, if it doesn't improve, then it's best to seek a professional for help.
Okay, I see. So if it's a first time injury, meaning they're experiencing tennis elbow for the first time, they can try to rest on their own.
Yeah, try to rest first.
If it comes back
Because
again,
if
they
it
should
comes back
visit.
again, seek a
They should
patient.
I should get them to visit a specialist like you. Yeah.
Yes, that's right. Most of the time, from what I know,
Mm.
people usually don't seek help when something occurs for the first time. Yeah, I think that's just the mentality of humans, right? Maybe we just brush it off like, or maybe it's not so serious, it's not so important. So most of the time, patients who come to me, their issues are really quite chronic or even acute on chronic, whereby they have been having this issue for a long time. It's just that it keeps reoccurring again with a lot of swelling. So we call it acute on chronic. Usually I don't see a lot of patients with just like for the first time they have like this acute injury and they try to seek for help. Yeah. I think just human mentality about
Yeah.
like
True.
knowing how to manage their symptoms. I think it's also due to the knowledge because maybe they don't know what it is. So they just prefer to push it aside first and then see how it goes. Yeah.
Okay. Yeah. True. Okay. And if they choose to recover at home, there's really nothing much they can do on their own besides icing and resting. I understand.
Yeah, as well as maybe some sort of gentle stretches or even self massage around the forearm
Yes.
can be helpful. Yeah, because usually the extensor muscles, you can see this is my forearm. The
Yeah.
extensor muscles that commonly contribute to tennis elbow are located around the middle portion or the inside of your forearm. So they're somewhere along here. So
Yeah.
if you have good knowledge of the anatomy of the human body, you can try to locate these muscles to perform some sort of self massage or rolling or just using your other hand to do something like that
Yeah.
actually can help to elevate the situation quite a bit. Alternatively, if you do find hard to locate this muscle, you can contract the muscles using movements like that or gripping. You can see the muscles already starting to have this kind of tension, so you know that this is the muscle that contributes to the movement of the wrist and the fingers. Then you
Yeah.
can start to also release in that manner. Yeah,
Yeah.
I
Yeah.
still feel that self-release, is quite important.
Okay. Yeah. Yeah, great. Yeah, all very useful information. I'm sure our players will appreciate. At least it gives them a general view of what to do and how to manage their tennis elbow should they experience one. Um, yep. So and if they have if any of our players have any further questions or if they wish to consult you, I'll definitely refer them to you as well.
Yeah, sure. Yeah, I think if they have any questions, they can just email or or call, and then I can just give them advice from there. Also, it's not a problem.
Okay. Okay, great. Chloe, thanks for your time and hope to chat with you again.
Thank you so much, Darren.